Jim Joyce, welcome.
Thank you. Here we are, another Wednesday. Happy, I don't know what it is. Happy. It's
Yeah, I
and
calculated today 13.7% of 2025 is already gone, is behind us.
okay. I
Crazy, right?
didn't calculate that. I
Yeah.
didn't calculate.
I don't know what made me do it, but I did.
We
But
had, we had 10 days of no sunshine in Dublin. In
all
Dublin.
right, so you're counting towards the warmer days, basically, and the
A little,
sunshine.
yeah, a
Okay,
little bit of sun creeped out today, so everyone was delighted with themselves.
that's amazing. And I thought you were in Nashville, which, by the way, the hallucination, like I can see that it's Nashville, but if you really look close, it's kind of Nashville or something. But our friends at Vive, at Health, putting
Yeah,
on
that's
Vive
so.
show.
I'm not at I'm not at Nashville, but in honor of the Vive Nashville, I decorated my hotel room with
I
some
love it.
guitar music and
Honestly, this is something that for our listeners and viewers, just to actually watch us on YouTube versus listening in, because I like this new routine that you have, like AI generated backgrounds for Jim Joyce. I can't
trying to
compete.
keep trying to keep the relationship fresh.
Listen, 160 plus episodes in.
We're searching.
I'm excited to let our guest in,
Awesome.
Dr. Payal Bhandari. Hopefully didn't butcher the name, but she will let us know as she comes on. Good
Hey,
morning.
Good morning.
Welcome to the shot. I was just saying that we're excited to let you into the communication room here, Dr. Payal Bhandari, and I was hoping that I didn't butcher your name fully. You can imagine that
hey.
everybody butchers
Yeah.
it, but anyway, yeah. See, there you go. And Jim and I have known each other for a decade and a half now, so you can't pronounce it.
I'm just
But
two syllables, Jim
yeah,
Joyce.
exactly. Jim, that's so easy, super easy. But I was just saying this was probably, it's an interesting, because we typically have people on that we've known for quite a while, that et cetera. And I know we met at JPM. I think Lucy made
Yeah.
right a quick intro right there, and then Jim, you met in the same room. I think this was Ritesh's plus event at JPM.
That was it.
So
Okay.
Yes,
it was
at the
all blurry.
ServiceNow event. Yes.
That's right. ServiceNow. Ritesh was with Finn. Congrats on the new gig, Ritesh. Shout out to you. But anyway, so I think we made a decision right there and then, because we're both fascinated with your story. And I think in today's world we've been talking about healthcare system is broken for, I don't know, I still had hair when I started talking about it. But anyway, for all our millions of listeners, viewers, we're excited to have you on. We'd love for you to take us through this journey of who is Payal? Who are you? What got you to where you are? And take your time. We got it here.
Okay. My name is Payal Bhandari,
See, I was close.
and coming from an Indian background, the name says a lot. So this is not my birth name; it's my married name. Payal represents technically the anklet that you wear, which represents music.
Oh, wow.
So in a sense, I would say I fundamentally believe in creating harmonious music. And music
wow.
must be experienced, not by just one, but by many. And that is what I believe my life represents, is that the evolution of sound is what we connect to as human beings, even before we can see and we can speak. And so I think that I would like my life to be a reflection of a sound, however it makes you feel, but it is also then a reflection of our story. Nilesh is
Love it.
my middle name, and it's also my husband's first name. Nilesh stands for Vishnu, which is or Krishna, which is the in the God of God is maintenance. He's the person
Okay.
who maintains your operations. So in a sense, it's about the essence of how do we create a sustainable life, not just for ourselves, but we are a unity of both our words and how they come together and how we then can impact through communication. And then Bhandari is my married last name. Bhandari stands for actually Bandar, which is the person who is a treasurer of a temple. And so
Okay.
it represents wealth. And wealth is truly the combination of knowledge with experience that transforms into wisdom. That is what real wealth is. It's not just materialistic wealth and the stuff you have. It's really that if today was the last day that I existed, I really want to create wealth. I want to love it and I want to spread it. So that really is a simple way to explain who I am and my story.
It-
Um, yeah.
Mic drop.
But,
Mic drop.
yeah, total mic drop. Amazing.
That's why I got a guitar for you. I didn't even know why I did this. You must have been sending spiritual sound through the
Are you
universe.
at Vive?
No, I
Right,
wasn't
that's
there.
what
I
we
wish
just
I was.
talked about. Yeah. But it's fun because Jim switches the background the last couple of episodes that we've been doing, and it just
Like a kid who
Yeah,
found
like
a boy.
yeah. Okay, so amazing summary of what encompasses you, but take us through again, personal, professional, however
Yeah.
you want to take
Simple.
it, the journey,
Okay.
right?
So
I
born
feel like
in
I want to
Jersey.
sing like West Virginia. What's that? You're West
I'm
Virginia?
from West Virginia. Yes. Yes.
Blue Ridge
So
Mountain.
moved there when I was 4. Parents from India wanted to own a business, and the only thing they could afford was a little tiny hotel in a small town in southern West Virginia. So I grew up in the motel,
Wow.
really understood business from how do you please customers, how do you exist as a business owner, and how do you manage operations from everything. You need to know how to clean rooms, do the laundry, fix anything. So I come from that business mindset. Also saw, like, in a place which is one of the poorest states in the country, um, the pros and cons of poverty. There are not a lot of opportunities. There is poverty represents a lot of ignorance in how the
Mhm.
government doesn't really invest in how do you enhance your community. And that can lead to a lot of tragedy. And so with that experience, I realized discrimination is a part of life. Like,
Mm.
it's just, instead of hating it, understand it. And as an Indian woman in a place that people only see black and white, and there's not that many black, what do I want to do with it?
Mhm.
And that kind of was a turning point where life-changing events led to, number one, what could I do? And that's really where I chose family medicine, because I was like, nobody's going to discriminate when you're a doctor. One, I can make a decent living. And if I do family medicine, I can be an entrepreneur because I get to call the shots and I can really connect with people. And that kind of led to going in the path of medicine, where there was a lot of obstacles where just family alone didn't really believe, like, that's really hard. You're a woman who needs to take care of her family. You need to not make as much as your husband makes. Like, how are you going to do this? And I said, you can do it. And through
You're like, I
that,
got this. I got
went to
this.
med school. Yeah, I was like, if you say no, I'm going to say yes. And so med school, West Virginia University, went to residency at the University of Massachusetts. And then again, another life-changing event, have our first daughter, immediately developed breast cancer. And it's, no, you need to get back to work in 9 weeks and be okay. But I realized that healthcare doesn't really have the answers. It is sick care. And we consistently keep believing that human beings are a mystery. And we treat them like specimens. We do all these tests and we either say, oh, you're really sick, oh, you're fine. But the person is sick and it's not in their head. And I think that initial experience for me woke me up, and it said, whoa, I need to take some responsibility of maybe I'm on a course that's destructive and I want to do something about it. The thing is that as a woman and as a mother, we do it for our families. We don't do it for ourselves. But
Mhm.
the people in our family, they may say, oh no, this person's got to be okay. And so that kind of was a turning point where my husband was like, we're going to change it up. And so we went from being in the East Coast to saying, let's start a new life. And so we literally picked San Francisco on the map, and we recognized it's got some key elements that would work for us, both professionally as entrepreneurs, family. It's a great place to live. And why not? So we just decided, we picked up. I
Pack
was
the
like, okay.
bags.
Yeah, I met this beautiful human being, Dr. Larry Shore, who said, hey, I need a woman physician. And I said, I need a job. And I saw the opportunity to say, I want to learn business because there's always a Kaiser and another big Sutter organization. There's plenty of jobs out there, but it is rare to learn the business side of medicine and to really get what does the customer want. Because what we realize is that customers, which are the patients, are the lowest common denominator in our healthcare system. We built a provider-centric platform, which is about providers are like, they're like robots who went through the success of their career by knowing how do you please your mentors, right? That's what it
Ingrained.
requires. And in a
Yeah.
sense, they're designed to say, how do we get paid? So the payers, they're like, drive down the cost. And the providers are saying, dude, make the person pre sick and give him the most expensive care. But it isn't aligned with what the patients want. And so I got this unique opportunity to understand all this. And it was right on the cusp of legislation saying we have to do electronic medical records. So I was living in this world of basically saying the world is moving to technology, but technology is just about an administrative structure. It's not changing operations at all. And our operations are getting really complicated. And so what happened was that we were driving amazing healthcare. And we said, well, why don't we strive to be the first accountable care organization in San Francisco? And so that's what we did. And then I realized that's a lot of words we sell, but we don't actually practice that type of care. It's still the same challenges. And you've got providers who don't get business. And so when the money runs out, the doors close.
And just to pause you, so this was, you now moved to San Francisco around what,
Yeah. And then I
2010-ish,
basically
right?
said,
Because
I'm
that's when
joining this
the
practice.
okay.
I learned the business side. In 8 years, we've become the first accountable care organization in San Francisco.
And what was
And
Nylish
that's
doing?
what?
Nylish was your husband's name, right?
Oh, Nilesh is my husband. Yeah. So
Yeah.
I
Was,
now
was
have,
he also a doctor, or is
he is not a doctor. He's in the
okay?
business side and the tech side. So he gives me a very different perspective of how
Okay.
to think about what really is business and how do you make it a win platform. And so that experience, I was heartbroken because I gave it my all and I really believe in value-based care. And I couldn't understand, how do you take this amazing place and how do we keep burning through money and our providers are like struggling and patients are not okay. And I think what I realized is that you have to pick your fights. And I wasn't going to fight an institutional problem. I was going to instead go direct to consumers and practice value-based care. But the difference was that I wanted to thrive as a human being. I was burnt out and that was really hurting my family. And there was other life-changing events that happened in our family. And that's, I think, also drove my shift towards how do I want to practice medicine? Because going back to my story of I got sick, I didn't really change a lot of my lifestyle except
Right.
for what I just said. But my now oldest
You moved
daughter,
across the country. You moved across the country.
we did that. But like San Francisco, you technically eat a little
Warmer
better
weather
and you're
too.
more active
Yeah.
and you're in nature and we were happy. But then what happened was that like our now oldest daughter's almost 6. And she literally all of a sudden develops severe abdominal pain. Within a week, she's in the OR. We're told she has an ovarian mass. And so she has the ovary taken out. And now I'm like in a situation where I am surrounded by some of the best specialists.
Mhm.
And they're like, yeah, we don't know what's happened. She was born with this and then bad luck happened. And now she has it. That's when I lost it. I said, I'm supposed to know what the heck I'm doing. And I should have done something to prevent this. And now
So you already had your family medicine
yeah. And as a family
specialization.
doctor,
Yeah. Okay.
you're like, you
Oh, you
want
took it
you
personally,
to
right? Like you,
solve every
like,
mystery, like
yeah.
be preventive. That's the foundation of family medicine. And I couldn't handle someone telling me, I don't know.
Right.
And I don't know means that you live with fear. And when you're a patient now and not just the provider, it's a really different experience
Sure.
where your heart sinks and you are like, I'm not going to take care of people from that. Accepting fear is an option of delivering care. And so it coincided with my getting sick and then launching the Accountable Care Organization and realizing we don't practice what we preach in medicine. And so that kind of led to a couple things, is that I went on the hunt to say, no tumor just happens. Nothing
Right.
just happens. The human body is not a mystery, but we keep selling mysteries. I said, if we go back in history, these are more recent shifts in our environmental ways of existing than they are with the human genome drastically changing. And so we really want to take accountability, but we need partnerships. And so that led to both the launch of my practice, where I went direct to consumers and really delivered value-based care, where I recognize if you can take out a lot of the noise, you can meet people where they are and you can do transformative work. And so I shifted away from primary care to integrative functional medicine because I really wanted to understand what's driving this.
And
One of the biggest things.
just
Go
for
ahead.
because we have a global audience and less informed. So what's integrative functional medicine?
It's exactly what the words are. Like
Okay.
functional is how do things work?
Yeah.
Right? So from a physiologic level, is understanding what's normal physiology, and pathology, it's not working right. And it's looking at it from all realms. So functional medicine is one school of thought, which kind of spun off from allopathic medicine.
Yeah.
But you've got to be more expansive than that, because it still builds from a similar way where you are understanding functional and you're opening up a whole new world, but it still falls into this trap where providers order lots of expensive
Yeah.
tests. They
Right.
order lots of supplements, and then people don't get off of anything. It's still confusing. And
Right.
I was like, I'm still struggling with this.
And I love this, and this is why we also wanted to have you, right? Because our healthcare system, the reimbursements, the conversation the last decade or so on value-based care are tied to the traditional medicine that we know, like the Western medicine.
Yes.
And there has been, I would say, just observationally, and you're in it, a little bit of this between functional and traditional, right?
Mhm.
And to me, functional, AKA really trying to find what the root cause is, just makes logical sense, right? What's the contradiction? Why so much tension between the practices of traditional, and I don't want to say versus, right? Because functional is still used as lab testing, but other
Yeah.
stuff that I'd love to dig
Right.
into and you have direct experience with. What's the
And I
what's
think
the
it goes
tension?
back to the scarcity platform. There's plenty. And it's about, we still operate from these silos. Instead of saying we could learn from each other and they both have a lot of value, it's more like, I don't know. I think it comes from this, who gets more attention and how do we bridge these worlds together? Because again, part of it is also tied to the economics around
I was going to ask, is technically a
economics and
functional
ego.
medicine reimbursable? I have no idea. No, right?
No, most people are out of pocket. A lot of these specialty tests are out of pocket. Supplements are out of pocket. So there's value to it. There is a value to it, but you've got to find a realistic way to move forward. We're not going to go one extreme way or another extreme way. We've got to find that merger. And so that's where integrative comes in, is how do you integrate not just the schools of thought, because again, functional is still built from a Western medicine platform. Okay? But
Right.
we live in a world which is not just made up of Western medicine. We live in a world where there are other medicines, and we're all different colors. And so integration, in a sense, is integrating from all these schools of thought. And
Right.
literally what I did was I built an integrative functional medical center, probably the largest on the private sector in San Francisco. And I brought in some of the best holistic practitioners. As I said, what's the best way to learn the different types of acupuncture, manual osteopathy, naturopathy? I just bring the world or the Bay Area's best together. And we focus on caring for us as providers first and learning from each other and creating one care plan. Our patients are all going to get better, because now when I don't understand something, because I just don't have that training, I can learn from the Chinese medicine expert and the naturopath. And I could be like, wow, that's what integrating is, that we integrated all of
Almost
that. We're
Jim.
coming out
Able
of
to do that.
silos. And integration is really not just, I think, on the healthcare side, but integration is also thinking about, in today's world, it is really about how do you integrate the technology in a way that really superpowers operations? Because in a sense, technology can be non-biased depending on how it's built, where it can really build scale and can do dynamic learning way
Yep.
more than a human can. And it also is understanding, integrating our payment models, right? And our incentives.
Before we go there, maybe just I want to kind of park this. I love this like integrative approach, right? To your comment, I can pull in so and so and so and learn, and we can discuss the case together. Also,
Yeah.
if I look at what an accountable care organization should do, it's a number of specialists, nurses, health coaches, others working together to solve a particular case. So is that
Yeah.
where the inspiration is? Again, back to the roots of even the
Yeah.
traditional Western medicine.
But it's
Still,
still like Western medicine is still like you have maybe providers within different specialties, maybe talking to each other, but they're still not, they don't go upstream to understand the root cause. It's still built on, if you imagine a tree and you've got the branches, it's like every branch is its own. And like
right.
when each branch is built a huge community around it, and you're like, we're still this one tree, this is one human being, and we really don't get the roots. So there's a kind of like I'm lost and I got these assumptions, so we're just going to fill it up with some stuff. And
Yeah.
it's not really, you don't get great outcomes. And the other thing with medicine is I always found it funny where we rank it based on our mortality rates. Like the person went to a hospital and they didn't die, or they came out in a wheelchair. And I'm like, our outcomes are not that great relative to a few hundred years ago when we didn't have all this modern technology, but we really don't analyze morbidity. And that's like a lot of factors. And so that's a big part of what human beings want.
Let's see, even in the longevity conversations, which I'm looking forward to, I think next week or the week after, we're going to have somebody on. We've been talking about lifespan, but the conversation is shifting to a health span, right? Just because you're 93 years old, but I hate to say it, if you're hating every day that you're living, how can we extend the health span of ourselves?
Yes.
Fascinating. And before Jim quickly dropped off and on, and I paused you
Sorry
at,
about
at
that.
the ACO to integrative comparison, you started talking about leveraging technology. And I think from that kind of scale perspective, you can't turn around and not hear about AI these days, analysis of labs, biomarkers that need to be validated. But at the same time, we all know what we feel our own biomarker. I hate to say this, but in a way, I don't need an Oura ring to tell me that I slept like shit, but it helps. So anyway, I'm trying to warm you up on the technology and kind of platform and AI discussion here and how
Yes.
functional medicine.
So I think that integrated functional medicine really allows the avenue for more precision and personalized medicine,
Okay.
which is really how we be very precise about the way that we look at data. And I think one of the most common things that is ordered is labs. There are thousands of labs that get ordered every single day. And they're like a benchmark that you do, but it's still very archaic system where it's like humans who are the experts that are analyzing the labs. But the thing is, it's not precise at all, because with seconds to review a case, you may look at only 3% of the data. So if you're missing 97% of it, and you have to realize that there are so many rules behind this engine to understand every single lab marker from science perspective, not from a reductive, like this lab represents this disease. It's from the science perspective. How do you understand every single biomarker from what is optimal for this human, like based on their race, ethnicity, and sex, not the general population research, which has mostly been derived from Northern European men, because it doesn't reflect our population. And the data, when you can harmonize all of that data to say, okay, we could go upstream and say, this isn't just about your cells and about your microbiome, but how do we go upstream to understand the organs? Can we extrapolate from that? Because that harmonizing of that data can give you much more insights into this human being right here, right now. So there's precision around that. And then it's about the extrapolation of the data allows personalization on the treatment. So now you're getting a little bit closer to root cause medicine, right? That is very different than what we practice in healthcare today.
Sure.
It's just right. Again, I'm trying to put things in perspective side by side, right? So you can go to LabCorp or Quest, and your doctor will tell you, here are the markers that you need to test for. Here's et cetera. Typically, what I've seen, and Marina, who also went through breast cancer, sometimes goes to functional medicine doc versus the traditional, and there's a lot more markers that are I'll call it turned on. And then Dr. Mark Hyman launched function lab testing.
Health. Yeah.
Function health, thank you. Yeah. What is the difference between function health, and I'm not asking you to compare his platform, but to the LabCorp Quest, et cetera? Do I just get more markers here? What's the benefit? Why? And you as a doctor,
no, I think
can you customize the lab?
Function health, just literally speak, functional health is out of pocket.
Okay, fair. Yeah.
So that, and then two, when you look at their interpretation, you still walk away being like, what do I do with this? And that kind of, I think, literally just, this was what led to the birth of the company Advanced Health Academy, which is, my husband, Nilesh, is the CEO of it and the CMO of it. And we really were like, the data doesn't lie. This is what I have done in my career, which is the data tells me a lot about this person. So I'm going to remove the guesswork, right?
Okay.
In terms of if we can, and what Advanced Health Academy does is it literally, we took over 4 years to look at the global research and to say, we're not just going to look at research that's in the US or just in certain countries in Europe or Japan. We need to look at research that's happening in Ethiopia and in India and in Australia, because that's all transparent. And so what happens is it differentiates between those different socioeconomic factors that are really important, not socioeconomic, like the demographics. Right. And it gives them the optimal range of each biomarker, which has to be fully science-backed. With your conventional medicine labs that you're talking about, if they give any kind of interpretation, it's still based on the United States general population research. It's not up to date with the science, right? It's oftentimes the reflection of the science is about 20 years behind. So what functional health does is it is more reflective of the US population, but not the global population. But here's the thing, in both of them, you walk away, what do I do with this? If we get a lot of information from just basic labs like CBC, complete metabolic panel, lipid panel, thyroid panel, right? Where if you could get a lot of key data from it and go upstream to understand, here's how my organs are functioning, and here's how every data point connects with it. And then it tells you precisely, here's the actual thing you really focus in on. So it takes out the guesswork for both the patient and the provider. And then it gives insights that are precise to all those labs to say these insights, which are lifestyle-based, will directly change your outcomes, right? So in that sense, the data then will help drive, I think, it's not fully AI-based because, again, AI, a lot of these platforms are still based on cognitive bias in terms of when you're looking at the data, you're like, how do you actually differentiate between the noise and what's real? And most of it is based on hospital data where there's humans who interpreted that data, put it in the documentation, right? But when you built platforms...
But also these learning models learned on
they're built all
data.
On that.
They're not, to your point, if the best practices of interpretation of the lab work is based on 20 years ago, which was mainly male population in US, again, and that's what the learning model will learn, right? And therefore their recommendations.
It's still built on this very specific silo of thinking, right? Versus you need to find a blend between what humans do is we are, in a sense, as providers, we're looking at all the rules we have at the front of our head, but we can't remember every rule. And number two, we now have basically most providers are specialists. So very few are from a primary care perspective that understand you need to understand all these organs and every ecosystem, but we've lost a lot of that. So when you take the science perspective, science in theory is supposed to be unbiased, right? And so when you take that perspective and you built from a heuristics rule platform, and then you know how to use the AI to optimize your workflow, then
Right.
you can surface data in a user-friendly way that optimizes both the workflow for providers. It democratizes information in ways that patients are not really readily available to today and what their data needs.
Right.
And also it's about how do you show diagnoses. So you got to show, hey, this person is sick, but it's okay if we say, hey, you have these issues going on when you're going from the health span. And then how do you then, which is important for the billing side, because you need to
Yep.
submit that this person is sick, you get higher revenues for it. You need a decreased insurance reimbursement. And it's about how do you drive positive outcomes for that human being.
It's what a level of sophistication and complexity. Even if you're like, I always think I've mentioned this before on the show, Eugene, that one of the best treatments I've ever got was at a Health Excel event in India. And they were doing genetic testing in the lobby or
I
something.
remember that.
Yeah. And then a geneticist called me up maybe a month later or something. And I filled out a big profile and they went through. And the way they explained the data to me versus the way they holistically put the whole thing together, I remember everything they told me. This was like probably 9 years ago. I remember everything because it was like, okay, yeah, you have what's your chance of multiple sclerosis or mental health conditions or prostate cancer? And it was like, okay, I should be worried about these two, and these other
Yes.
ones, I should just run with it because it's not gonna
Yes.
get me. And,
Yeah. Yeah.
You,
yeah.
you run quicker than it can possibly get you, kind of thing, right? You just keep running.
So if I go to your clinic, do I get this? I feel like I'm terrified a little bit of this fully comprehensive exam that's gonna tell me everything. Like, I'm not sure how much knowledge I could handle if I was a if I was a consumer
Well,
market.
now my practice is virtual, right? Because COVID helped me accelerate the
Yeah.
going online, but it's also led to the birth of these other startups that I'm actively involved in. So
Okay.
what would your experience be like? It would be very much about, number one, we're on a journey together and meeting you where you are. It's about how do we shift from fear-based to empowerment-based. So it is very data focused where you take a very simple medical intake form and then the data helps me to meet people where they are, right? And that was the birth of AHA, which is that this is what I was doing. And then we built out a medical advisory team to say, the story's all there in the numbers, but like, how do we understand what that story is, right? And really be conscious of the cognitive biases of somebody else's interpretation of the data
Okay.
and respect that person's story when they're just telling their life story. And so that becomes one of the first things that happens, which is, okay, what's the data say? And if you have many labs, it's like, what's the trends report say? And that the way the body works, it's like an ecosystem where, yes, there's some areas that are really stressed out, but there's other areas we can support, right? So how
Okay.
do we remodulate to optimize how your cells are functioning and your microbiome and recognize that, yeah, disease does not happen overnight. So all these things that people worry about, it's almost like when they get told, they're like, oh, it happened to you. It didn't
Right.
happen to you.
As the
It's a
announcement.
part of you. And
Right.
that we currently in our traditional model don't even address disease until stage 3B at the earliest. And there's 5 stages. And oftentimes you don't even get told until you're at stage 4. And 5 is the end. So
Right.
if we're able to address a disease early on, that's lifestyle is the only thing that really helps that, right? Because lifestyle is food is medicine. So it's about like
How
how
about music as
information,
medicine?
Yeah, music is
Back
music
to
is
music as
medicine
medicine.
because it's
Yeah, right.
like that's we're gonna talk about music. Do you bring when do you bring music into this treatment? Like during the appointment, do you singing?
I do bring singing into it, but I do it later on because it's all about receptivity. But I think the way music comes into the picture right away is how we modulate our voice
Ooh.
to come from a place of compassion And to also realize we are an authority figure, that we use the power of our voice to empower people's voices. So they
Okay.
start to shift how they're thinking, right?
Right.
Because oftentimes 90
Yeah.
plus percent of people's thoughts is what I call the 4 C's of cancer. It's complaining, criticizing, comparing, and compromising. So
Mm.
if their thoughts that sound is a very like high frequency catabolic sound. So in a sense, my voice and how I modulate my voice directly impacts how a person is going to think and they're going to feel,
Right.
right? There's really a lot of attunement to that is important in the experience, because the key is that when you are direct to consumer, you need to drive results and keep your
Yeah.
customers happy,
And that's
right?
actually, I was
It's
going to ask
about,
you on the BBC, because I think our healthcare system defines it as managing cost ultimately for the payer. And you define it as, hey, I'm accountable with you for your health, and I'm going to charge you no matter what, this much per month,
yeah,
right? And you're there to help that person on a journey, right? So
yeah,
it's up to that person to control their costs, for lack of a better term, and they're
yes,
in it with you in theory,
yeah,
right?
yeah, yeah.
Okay,
They're
so I'm
both
just
an
trying to understand what
accountability
you mean
partner.
by BBC in a direct to consumer
Yeah,
model. Okay.
that yeah, we built a model. And in some ways, we communicate to consumers, don't worry about it. Like, you're paying $20 for your copay. You don't need to take accountability because we got a pill for you. And oh, if that happens, we got another pill for you. And if that happens, we got a surgery for you. That person's, oh, this is not very good. So it's not built on educating people to be like, this isn't working.
Mhm.
And so when you create like a direct to consumer model, it really changes the paradigm in terms of what is accountability. And it's got to work for every party involved.
Mm.
So I'll maybe challenge you in a little bit on this direct to consumer, right? I think our friend Matthew Holt posted something the other day that, hey, if in 2010 somebody told me that the most valued company, digital health companies in the stock market would be one prescribing you ED, hair loss, and weight loss drugs, aka Hims and Hers, and the other one is a company, aka Doximity, that is advertising to doctors, do you fold up shop and forget about the future of digital health and healthcare, right? And on the side of it, I had a conversation saying, look, if you're a relatively-ish healthy person, you're still out of pocket between for your family insurance, probably paying in US 20 to 30 grand, which can be accomplished very much by going to a functional medicine doctor, controlling your costs that way, and taking care of your family for probably about the same thing, and still
Right.
potentially even feeling better. So I'm curious, I'm challenging a little bit of why isn't everybody then swapping over to functional medicine, direct to consumer model versus being on the other side with the
Yeah, it's a
health
good question.
insurers,
I think that there's been talks on consumers are going to pay for this, but you're not going to change the system that quickly, because if you look at you've got, I don't know, you've got a large 40% of the population is probably either Medicare or Medicaid.
Yeah.
And you got this whole other side, which is gets their insurance from their employers. And then you got this middle space where people are like gig workers or they're small business owners and they're paying out of pocket. But in the big scheme of things, people are not trained to pay for services out of pocket
Yeah.
and the United States. And so that is not going to fully just take over. But I think that we are entering into a space where there is more seriousness around the value-based care element, where the United States is one of the unhealthiest countries in the world. And we literally just don't invest in prevention. And everything that we're dealing with chronic disease, it's prevention based.
Mm.
And so,
I feel like just our comparative, obviously Eugene's in Barcelona and I'm in Dublin, Ireland, but we're both from the States, so we get exposure to both systems. And I think it just feels to me like when we bring a group of entrepreneurs, digital health clinicians, or whoever to Europe, and you put them in the same room next to European healthcare one, the US entrepreneurs and healthcare executives will talk about money all the time, transaction money. And then the European ones, you might get a conversation and they might not bring it up, to the chagrin of probably of the US VCs.
yeah,
The US VCs, like, why did you ever mention reimbursement codes and money and transaction. And it just feels to me like I just think of my days as so transactional based.
Yes.
It's the next health transaction. I'm on an annual plan that I got to re-sign
Yeah.
up for next year based on my employer. Look at
Yeah.
your plan. And so I'm not, I stretch myself to possibly think about a year, right? And
Yeah.
then, so
Yeah.
possibly a year. And then I know I'm probably going to leave my employer in 3 or 4 years. So that's like the
Yeah.
outside action. I never think I'm going to live another 10 years, 20 years, or
Yeah.
we're
Decisions
taught.
are made literally just exactly what you described, which is, I think that have to find a middle path, basically, where we have to realize where the public is. The public is now willing to invest. I think the pandemic really shifted people's attitude about, the word health finally came into the conversation in a way that it hadn't before. And I think that on the payer side, I think that there is more attention to value. I think that there's a lot of challenges on how to drive real value-based care because, again, I think you gave the perfect example is that you've got people who are experts in different silos, but there are very few that truly understand primary care and understand the customers, understand the providers. So they're filling the gaps that they don't understand with assumptions based on what they already know. But what we're seeing over and over again is that a lot of failures, right? You've got a bunch of companies that have gone into spaces like I don't know, the Walmart mini clinics and
Mhm.
the uh, the One Medicals, et cetera. And they really have not driven that much impact. And so they've raised a ton of money, they burned through that money, and they really closed their doors because they're not really driving those impacts. And they got to make shortcuts based on the way the financial models are set. So I think we are on the verge of a birth of a new middle ground.
Listen, I think we're all hopeful on all of this, and maybe there's really a crazy time just flies. So two things before we go to Jim's famous last question. So one, I just want to, how do you do all of this? Because so you have your own practice that's now virtual, and I did read. You normally don't prep for this, to be honest, but I did read that you've been voted like best doctor since 2008 in San Fran. You, with your husband, running the Advanced Health Academy.
Yes.
And the way Lucy, I think, introduced it, that you also either launched or launching
Yes.
Bly Health, so AI-based women's
Yes.
health
I'm launching
platform.
another
Let,
startup.
let's, how do you
How
do
do
it
you do it?
all? And tell us a little bit about Bly and what you're
Yeah.
trying to
And
accomplish
are we
there
talking
before we
to an
move on.
AI right now? Are we talking to
Yeah,
a
Yes.
exactly.
person actually
Yes.
aware?
How do I do it all? I would say a lot of love. A lot of
Okay.
love, staying true to I am here for a purpose. And I, yes, I take ownership of, I work really hard. I love what I do. I feel a real importance to humanize healthcare. That is, we are together socializing how to make change. Change is not going to happen and you just wait for it. You got to be the change maker. And so I strongly believe you got to live what you talk about. And the birth of these new companies is just, to me, makes sense because I've realized in the really just recent past that I'm a unicorn where primary care has disappeared, but and it's disappearing like very fast. And there's
Mhm.
very few people who had 20 years in the experience. And I spend a large percentage of it understanding how do I make these customers happy, but I as a human being have to thrive. So it's about the more skills that you develop, the more you don't do the stuff that you used to do, but you understand it. And with this new company, Thymos Health, it's basically an AI empowered platform and virtual care service that can diagnose disease stage, treat, and reverse all 150 autoimmune disorders. And what we do is we really understand the epigenetics, the psychological, emotional, and this pathophysiology of a human being. So when we understand that, we can extrapolate so much more data in terms of the microbiome, organ functions, how fast are your cells dying, what's your cognitive function, systemic inflammation. And that's how we not just separately dive to diagnoses, but how do we customize the treatment? Because that is true root cause medicine, where that precision means we can drive results with the treatment plan, and that you're real time collecting data all the time. So you can constantly modulate your care plan according to where that person is at that time.
And how much of that care plan is lifestyle? Because I'm going to be selfish
It
about
is
the next part
very
of this
heavily
topic.
lifestyle based. It does include medications because you do need meds.
Sure.
Uh, you cannot just do everything lifestyle based.
Agreed.
But yes, it is about understanding how do you do behavioral change modeling
Right.
from a shift how you think to shift how you speak, shift your actions. And it has to come from a place of empowerment where the person feels like, oh, wow. Yeah, I think I feel like I like that. Right. But it's, again, go back to music, which is I'm trying to shift the vibrational frequency of those cells and the microbiome and make a person feel good and celebrate all their wins and also help them realize you're
I'm,
going to have a
I'm,
downturn, but we're
I'm
going to
not
be
even
with
being
you on that.
treated by you, but I feel better already just
Yeah,
by the
exactly.
sound of your voice. One
Feeling.
quick last one around this. And again, this is going to be very selfish around. So do you see a day where your new company, you take on a virtual or a real patient virtually, epigenome, genomics, microbiome, you combine all this stuff, the system diagnoses you as a functional medicine doctor, say, here's your care plan. You will talk to that individual, understand their health journey. And then where do you see like health coaching? Maureen and I, we run a health coaching company, and somebody like Dr. Sandra Schaumbaum runs Functional Medicine Academy. So it is tied with functional medicine. How do you see this? Because you only have limited amount of time, but behavior change is hard. So maybe I'm the
No,
leading
no, I
question a
think that
bit,
it's
but
actually I think what it does is it takes out the guesswork and it really helps humans connect with humans in terms of it
yep.
enhances the communication by both parties are like, here's what the data is saying. And how do we make this come to life? So with health coaching, it's really about make it real. Meet me where I am and take out the assumptions and like, we're on the same page right now. And I think that's where the collaboration with different providers comes into play, which is when you help surface the interpretation of data in a way that you can process it, then the how to change things is part of what humans are dying for, right? Because we live in a lonely world where we want human connection, but we're scared. And so it's about the socialization of we want to be in this together, right? So this platform may it be direct to consumer in the beginning. It's really about empowering providers, especially primary care providers. And I think primary care providers are not just MDs anymore. They're really
Yeah.
nurses, they're PAs, they're like coaches, right? Where they're family members. They're really the people who are really the front line. And it's about empowering them to feel that you can trust the data, that it's fully science backed, it drives results, and it's going to make a difference. And so I think that's really where you can really think through value based, where it's not a
Yeah.
let's take all these people out of the game. It's about let's enhance the people who actually are aligned with this. And yeah, on a macro level, does that help us decrease some of our bottlenecks in healthcare where we don't have an escalation of providers that are fully burnt out and just leaving medicine completely? We still need each other. And so I think it's about addressing these bottlenecks head on and not just saying, hey, we need more research, which is not going to get to the front lines that quickly. We
Yep.
don't need to sell more pharmaceutical drugs that make people sicker if it's not indicated for that human being for their health. We just need to drive that change. And I think this is a platform that'll make it happen.
I love that. I remember there was one question. We never really talked politics, so this is not about politics here. But with RFK Jr. now heading up HHS and take out the names, take out some of the messaging, make America healthy. I don't know if again, but just make America healthy. I don't know if we were or not. What are your thoughts on? I know there was some things already published as far as what the priorities are, et cetera. But just maybe overarching message and how do you potentially see this kind of, let's call it traditional Western medicine Are we going to see significant changes in prevention? What are your thoughts, and how's this change in HHS beneficial or not for your business?
I think it's great for my business. I think it's changing the conversations, which itself is a big deal, where precision medicine and personalized medicine, which is what they're marketing, is all about go upstream to understand the root cause. And the root cause is as much with our food and our food systems. We have a sick care system that is not really empowering our public. And I think one of the biggest things that it may do is just start shifting our what do we think about public health, right? That's gone to the wayside for a long time in the United States. And we continuously sell things that are not driving results. And we market it like the life-saving things that are either you were going to die or, yeah, the hospital's going to help you. But that's not healthcare. Healthcare does not start in a hospital. I think that they actually are, at least if you, I don't know what they'll accomplish, but I
Yeah.
think the point is that get the conversation started. And I think more than anything, it's about we need to take accountability. As human beings, we're more aligned than we are separate. And so this is basically, I think, unifying that this is the truth is we are not a healthy nation. We lean towards fighting and violence, not and it's not aligned with what everybody wants. And so it's taking responsibility. So I think it's great for what I'm doing. I think it's great for the merger of how technologies come into healthcare. I think there's going to be a lot of upset people because you're changing systems there are certain players who have very much benefited from it, but as a public, they have not. And the public has to take accountability too for their own choices.
And at the end of the day, we all need to individually, right? And Maureen always says this, most people don't know how bad they've been feeling until they feel better and comparing. And so the question is, if you change your food for just one day, you can probably feel what that good feeling at the end of that day, right? So
Yeah.
with that, Jim, let's go to you for the last question of the hour here.
It's a tricky one. Okay. So we're going to go forward. We're going to go into the future. We're going to blast ourselves into the future. And we're going to do that in order to go backwards. So 10 years from now, not far from where we met at JP Morgan, there's a special kind of event happening sponsored by the top healthcare companies and industries everywhere. And they've asked you to keynote a conference called Humans Helping Humans. And at this conference, you're keynoting it around the fact that you've integrated Western, traditional, functional, and AI medicine all into this value-based care proposition that the outcomes are extraordinary, and exemplar. People are taking your model, they're implementing across the world. And you're giving this talk, and you start up and there's beautiful music playing as you walk up onto the stage, and everyone's there and you're excited about it. And just as you end your talk and it goes fantastic, there's this young, intelligent, charismatic woman in the audience, and she comes running up towards you and she's like, "You don't understand, Dr. Payal. I've been following you. And I grew up a daughter of hoteliers in West Virginia. And I went on to medical school, and I then married an engineering husband. And we moved out to California. I'm just about to start my first company in AI-based, value-based care. And what's that one piece of advice you would give the younger version of yourself?"
Dream so big that you don't let your ego get in the way.
Wow. Amazing. Thank you so much for joining us. I do wish this was one of our long form episodes because I think we could have taken so many turns, but I'm sure there'll be a chance. And congrats on all the progress. It was lovely to have you. And for all our listeners and viewers, hit subscribe, pass it on, and we'll see you next week.
That was
Thank
awesome.
you guys. This has been a real honor.